everyone, so today we will talk about the newborn reflexes, which is also known as infant reflexes or baby reflexes, which is normal and is very crucial for baby survival. They are the baby muscle reaction, involuntary movements, or neurological response to a stimulation which triggers them which is triggered by the sound, light, sudden movement, and being stroked or being touched. So when we talk about the newborn reflexes, the most common 7 type of reflexes which are present in them are the moro reflex, stepping reflex, rooting reflex, sucking reflex, tonic neck reflex, babinski reflex, and the grasp reflex. These are the 7 most common type of newborn reflexes which are present in them. First we will talk about the moro reflex, which usually occurs when a baby gets startled by a loud sound, sudden movement, or intense light. As a response to the trigger, the baby suddenly lifts the arms and legs, curl them back toward the body, and then throw the head back. So it is also very important to know that when this startle reflex go away. So the moro or the startle reflex usually lasts for about 5 to 6 months. The next reflex which we will talk about. First of all, I'll show you the image of the moro reflex. As you can see in the image, the baby is lifting the arms and legs, curling them back towards the body. So this is what is the moro reflex. Now, the rooting reflex. This newborn reflex begins by touching or stroking the corner of the baby's mouth or when it touches the mother's skin or nipple. When triggered, you will notice that the baby will turn his head and open his or her mouth to follow the root in the direction of the stroking. So the rooting reflex helps the baby find the breast or the bottle and also helps prepare him or her to suck. As you can see in the image, I am showing you for the rooting reflex. So this is what the rooting reflex in babies usually lasts for about 4 months. After that, rooting becomes a voluntary response rather than a reflex. Next reflex what we will talk about is sucking reflex. When the roof of the mouth is stimulated or when you place the mother's breast or bottle in his or her mouth, the baby will place the lips over the nipples and squeeze it between the tongue and the roof of the mouth. Next, the baby will move his or her tongue to the nipple to suck and milk the breast. Premature babies which are not full term, so premature babies may take weeks to properly suck and swallow. As you can see in the image also, I'll show you. The sucking reflex usually lasts until the baby is 4 month old. So this is all about the sucking reflex. Next we will talk about tonic neck reflex, also known as fencing reflex. The tonic neck reflex happens when the baby's head turns to one side. This is triggered when you stroke or tap the side of the baby's spine while the baby lies on his or her stomach. For instance, if the baby head turns to the right arm will stretch out and then the left arm will bend at the elbow, which gives the appearance of the fencing, so it is also known as the fencing position. So when does the tonic neck reflex go away? Tonic neck reflex may last until the baby is around 5 to 6 months.